get a license before she administers that drug to you? Yes, it's your right to ask for a license before she treats you, so she doesn't give you a death sentence. Hello, my beautiful people. You're welcome to another episode of Nursing with Abby. And today I'm going to be facing quackery in nursing in Nigeria. Now, why is it important? It's important because our lives, my life, your life, has no duplicates. And it should not be gambled upon by unlicensed people. Now, my name is Nurse Abiodun. I'm a nurse, I'm a midwife, I'm a public health advocate licensed by the Nursing and Midwifery Council of Nigeria, and I have a passion. I love what I do. On this channel, we talk about nursing, lifestyle, and everything in between. But practically speaking, you could go to a store and get a phone. If you get home and you try the phone and it's bad, you could always return it, right? Good. Now, you could get your clothes to the seamstress or the tailor, like people call them, and they mismanage your clothes. You could go to the market to get another one. But if your health is mismanaged, can you get a replacement? Now, this is what informed this campaign against quackery in Nigeria. So many people have unduly gone to their treatment of patients in the hospital because they were treated by unlicensed nurses. Now, sincerely, if an unlicensed nurse treats you, it's impossible to sue her because of a malpractice because she doesn't even have a license to show. For truth, you'll be wondering, how do we now differentiate between correct nurses or registered nurses and unlicensed nurses or quack nurses? Now, I'm going to be giving you 3 different methods that you can use to differentiate between real nurses and quack nurses. Yes, you're welcome again. Like I said, 3 different ways that you can differentiate between a real nurse and a quack nurse. Now, for every real nurse registered and licensed by the Nursing and Midwifery Council of Nigeria, it's important that they must have what we call a nursing license. Now, that license is not the hospital ID card. That one is by the way. Hospital ID card just shows you that the person works in the hospital, and it could be a cleaner or the MD, my managing director. So, how do you know who exactly is a real nurse? The nurse must have a nursing license which is registered and issued by the Nursing and Midwifery Council of Nigeria. The nursing license must have the nurse's name, full name, must have the nurse's picture so you can see against the person taking care of you, and also must have a unique license number that is unique to her, and no other nurse in Nigeria shares that particular number. Now, so you see, getting to see their license gives you a better picture or view of who is taking care of you. You could also request to have the name or the license number written, so if there's any malpractice, you can directly sue that nurse. Another thing is that before even the other practitioners take care of you, you can always ask for their pedigree. It's your right to know. Another way you can know a licensed nurse from quacks or licensed nurse is that the licensed nurses will tell you what treatment they are giving to you. They will introduce themselves appropriately, tell you what treatment they are giving to you, ask you questions about your allergies, and they will treat you nicely. Now, I know of quite a number of real nurses who might probably have a little bit of, issues, anger issues or behavioral issues. That's just a little of the pack. But real nurses will explain to you what they want to do to you, tell you the procedure, ask for your cooperation, and treat you gently and nicely. Now, what other way can we differentiate a real nurse from a quack nurse? Another method or way of differentiating a real nurse from a quack nurse is that you will look at the environment that you're receiving care. Now, it could be a government hospital, it could be a private hospital, but the mien and the appearance of a real nurse differentiates from the quacks or those who are not licensed. So it is important for you to use all these measures to differentiate between a real nurse and a quack nurse. Now, what are the disadvantages of having a quack nurse treat you? Like I said, if a quack nurse mismanages you, it's impossible to sue such a nurse because she doesn't even have a license to show. So, your health and your life is at risk because you took yourself to an unlicensed nurse. Gone are the days where you just call any nurse this or nurse that. And then they carry a pot or a bag containing all the various items that they can use to treat. If such a nurse is not licensed, do not allow such a nurse to treat you. Because somebody has been given injection for the past 50 years does not make the person a licensed nurse. Having to get a license as a registered nurse and midwife from the Nursing and Midwifery Council requires at least 3 to 5 years of intensive theoretical and practical training at either the schools of nursing or the university offering nursing as a degree. Now, when you go through such rigorous training, you will be going through series of examinations also. And those examinations are to groom you, teach you, and mold you to become the best nurse that you can be. Now, on international standards, it's important also for the community to know, the public to know, the environment to also be aware that we all need to wage this war against quackery in Nigeria. For all those institutions that you are training these nurses or quacks to be nurses, in quotes, please desist from that. You could train them and call them a name like assistant or attendant or whatever and give them their designation, which is different from real nurses. Of a truth, you could train them to be file carriers, you could train them to be attendant or assistant, but definitely don't train them to be nurses because it cannot be like nurses. They can't be like nurses. They don't have the knowledge, the expertise, the experience, the theoretical and practical experience that you learn in the hospital and also on the wards with the schools of nursing and universities. So, my beautiful people, today I'm really here to actually talk about how we all can work hand in hand to ensure that we stop quackery in nursing. Number one, ensure that you check their license before you get treated. Number two, ensure that whatever institution that you're going to receive medical care is government approved. Yes, it's government approved, and you can, they have their plate to show for it. Maybe from the government agency governing them. Also, ensure that you ask questions about what kind of medication you're taking. It's your right to know. So when you see a nurse having to stammer or having to evade questions about the kind of treatment he or she is giving to you, then you sense that this one could be a quack nurse. It's also important for the government also to form strict sanctions against these hospitals that are training these nurses and making them become slaves and less than a person, because the humiliating condition through which these people are treated, it doesn't make sense. And then after about few months of training, they now do a pomp and pageantry freedom party for them. That's so absurd, like the one you're seeing on the screen right now. A nurse is not a tailor. A nurse is not a seamstress or a hairdresser that you go to do freedom for and receive a certificate that does not even count for anything. Parents, don't be deceived. Ensure that your child is fully registered with Nursing and Midwifery Council, goes to school, does her JAMB or does her direct entry, enter the schools of nursing or the university as the case may be, and let her train to be an effective and efficient nurse so that we all can be proud of ourselves. So, that's all I have for you on today as the Nursing with Abby. Please ensure that you join us at this anti-quackery campaign, because together we can't stop quackery in Nigeria. We can bring about restoration of health, life and safety in Nigeria. Please spread the word. Check their license before you get treated so they don't give you a death sentence. Bye for now.